think my regards to Chair giving me this particular opportunity to speak my mind on breastfeeding and golden hour. The gynecologists should support this breastfeeding mission. Like me, you also believe that बच्चे के लिए माँ का दूध अमृत के समान है. Now what we have to do, that we should have a dedicated counseling session of breastfeeding will be a good obstetric practice. Breastfeeding is recognized as a complete nutrition for infant, providing numerous benefits to both mother and the child. It makes the child strong. हमारे हिंदुस्तान में बहुत कॉमन सेइंग है, अगर माँ का दूध पिया है तो ये करके दिखाओ. नहीं कहा? So it makes them strong by giving protection against child infections. It increases their intelligence and probable future reduction of non-communicable diseases like obesity, diabetes, and stroke. Besides shaping the mother, it gives protection against breast cancer and improves birth spacing, and also protect against ovarian cancer, type 2 diabetes, and many other non-communicable diseases. Now this particular slide shows very well that it improves the health and the development of the child. It also improves the health of the mother. It causes cognitive development of the child, learning and educational attainment is good. This, because they are strong, it increases their productivity, and by productivity indirectly the wages are increased, and finally it increases the country's wealth. This slide also summarizes the same thing as far as the woman is concerned, that it decreases the rate of breast and ovarian cancer, and she is less liable to get non-communicable diseases, and topping the list is diabetes. As far as the small child is concerned, you can see there is an improvement in the survival. The neonatal mortality is decreased, so is the neonatal morbidity. It lowers the diarrhea incidence in early childhood, severity of lower pneumonia incidences, and once the child is grown up, it improves mortality, infant mortality. It lowers the rates of obesity and other NCD problems, and goes without saying that all diarrheal problems are related to that are decreased, and these people definitely have a higher IQ and better physical stamina. And in adulthood you can find that all incidents of NCD related things are markedly decreased. Now why this topic? The golden hour of breastfeeding is one of the very important aspects. This was not there in the history. If you trace back the history all over the world, you can find India is a country which is always promoting breastfeeding. And when the breastfeeding was not available in older times, there was a practice to employ a dhai, wet nurse, to do that particular job. And as far as the importance of first hour feeding is concerned, I find this was missing. There was a prevalence of giving them early feed, but that early feed was शहद देना, घुट्टी देना, उस तरह की चीज़ें दिलवाते थे, and it was part of the ritual that one of the very important family member or some purohit of the family will come, उसके जीभ में कुछ ओम लिखेंगे और कुछ लिखेंगे, but you know this 1 hour feeding by the mother and the skin and skin contact was missing. Now as far as I have learned the lesson in the last 50 years since the time I've done my post graduation is that breastfeeding in the first 6 months is crucial. Exclusive breastfeeding. It protects the infant from childhood illnesses. Mothers should continue breastfeeding at work in case if she goes outside for work. Now previously the people who used to go outside for work, as far as India was concerned, is in the agricultural field or doing a low job, and there always you can find that ये अपना बच्चा टांग देती थी और उसके बाद बीच बीच में जब उसको फीडिंग की ज़रूरत होती थी, she used to do it. And I also feel now, though the practice of giving facilities of that particular kind are missing at our workplaces, though it is 50% all the world over, she should continue to breastfeed at work. Benefits mothers, it reduces the risk of breast and ovarian cancer, you must remember, and type 2 diabetes and postpartum depression also goes away. Infant formula does not contain any antibodies found in the breast milk, so should not be promoted. It's a big myth in people's mind, in doctors' mind, in nurses' mind, in public mind, that formula feed is equal to breastfeeding. Big no. The transmission of HIV, we all know about it, that through breastfeeding can be, if the breastfeeding is not given, you can reduce it, but that you can get it done through the retroviral drugs also, because if there is a zero viral load, there is a zero transmission. So that should be the aim in case if you want to give breastfeeding, that we should have a zero viral load. नहीं चाहिए भैया, ये मैडम के लिए, वंदना के लिए. Solid food should be faced as 6 months or after, and long-term benefits for children as there's a reduced obesity, type 2 diabetes, along with a better performance and intelligence test as far as this individual is concerned. So the first golden hour is defined as the first hour postnatal of baby's postnatal life. Breastfeeding in this initial hour of life can provide healthy future for the newborn. So the golden hour is the golden rule for baby nutrition. Along with it, skin-to-skin contact plus breastfeeding to be initiated within this golden hour. Pasteurized donor human milk to be used whenever mother milk is not available. Avoid formula feeds or bovine feeds, which is naturally the part of the formula feeds in this particular golden hour. The UNICEF message is wide and clear. This is for last almost 2 decades, that you have to give only breast milk in this particular golden hour, and in case if this is not available, it should be replaced by donor human milk. The WHO also gives the same message, that there should be an exclusive breastfeeding for 6 months and gradually introduce other nutritious food at 6 months onwards, along with the solid foods, plus the breastfeeding should be continued for minimum period of 2 years in case if it is possible. So the benefits are that you do start breastfeeding within 1 hour after birth, very, very important. Secondly, 6 months exclusively breastfeeding, and 2 years means that after 6 months add solids, but continue breastfeeding as much as possible by the mother. And this alone practice can save 1 million lives per year. 1 million lives per year. Now, the government of India emphasized golden hour nutrition is critical for newborns, and this is Ministry of Health data is that the human milk feeding during the golden hour can prevent 1/5 of the neonatal deaths. 1 in 5 deaths can be prevented. Babies started on a human milk after this golden hour have twice the risk of dying. So if you give it, you can definitely reduce neonatal mortality by 20%. And again, the government of India figures are that 60% of the newborns, infant, are not receiving human milk feeding within this golden hour. And that's what the aim is, that we gynecologists should definitely take this as a mission. Now this shows that if you start breastfeeding on the day 1, forget about the first hour, 16% of the neonatal lives can be saved. But if you start breastfeeding in this golden hour of 1 hour, 22% of breastfeeding who are started, 22% of the mortality is reduced in case if the breastfeeding is started in this golden hour. Neonatal mortality was also shown to increase markedly as delay in initiation increased. And nearly 40% of the newborn infants are receiving human milk feeding within this hour, according to both National Family Health Survey 4 and 5. Now, this is UNICEF has given this particular chart that you can see the word over feeding in the first hour is 45%, and in least developed countries where this kind of message is not there, it is around 53%. You can see that Western world it is about 35%, East Asia 41%, South Asia including us is 42%, Latin America is 50%, and Eastern and Southern Africa it is almost 60%. So India is at 40% now for this golden hour. This is your challenge which gynecologists must take, that not only they do it themselves, they see to it, it is practical. I am glad that in Cloud9 Hospital, it's a universal practice. Now there is no hassle. आपको remind करने की ज़रूरत नहीं है. आप उनको बताएंगे कि skin to skin contact भी ज़रूरी है और breastfeeding भी ज़रूरी है. It is very beautifully done. And our aim is to make it 100%. Our aim is to make it 100%. So I'm going to repeat what I have talked so far repeatedly. So the recap is the research benefits of the golden hour plus skin to skin contact plus the rooming in 24/7 is important. And the research has shown that it improves infant feeding, better lactation process, effective lactation gets started, and reduce risk of infant mortality and morbidity. Breastfeeding during golden hour can also give long-term benefits, which I have just now highlighted. Now, we must encourage skin-to-skin contact immediately after birth because, again, it increases infant and mother bonding and effective breastfeeding is there. It is said that in case if the child is fed on the breast, after this the child sleeps. But this remembrance remains, and you find that when the second time the child is put to breast, it is absolutely very effective. The doctors and nurses should encourage and support skin-to-skin contact during the golden hour, even for infants who require medical intention and procedures. The specialists and lactational experts are definitely can chip in here to gap this particular small percentage of cases. Provide education and support in the antenatal period by dedicated antenatal counseling session. In the Western world, not only they have an antenatal classes, but they have classes relation to breastfeeding where they tell them all the positions, all advantages, everything pertaining to what are the neonatal problems are there with the baby. They are definitely told at this particular time, and the time has come that we also should have dedicated breastfeeding on those three motives. So we must tell them about the proper breastfeeding techniques, positioning and latch, milk supply management. Here comes, I also heard this particular term for the first time because on the 6th in Manipal Hospital they are doing lactogenesis workshop in low risk to high risk cases. And for the first time I read this particular term, and the term says that there are 4 stages of lactogenesis. And in the 4 stages of lactogenesis, first is the development takes place. And this development takes place by mid-pregnancy. And that's the reason in all of us mind is there कि अगर preterm birth होगा तो माँ feed नहीं कर पाएगी. But that's wrong. Even the mother who has given birth to preterm birth can feed the child because she has got the development of that particular stage. I will dilate this particular thing on the 7th. We will have a webinar on breastfeeding, and then we will speak on this particular aspect. So the healthcare professionals not only have to do this counseling, but also they must know the resources and refer to breast-friendly services, breastfeeding support in the groups, lactational consultant they should know, because once they are discharged from the hospital, they must be able to give these names so they can take the help as far as the lactation is concerned. Now, addressing medical concern in some cases where there is a concern that you probably not be able to give this golden hour breastfeeding, like in an infant respiratory syndrome, infant respiratory distress, and whenever there is a medical, maternal medical problems, and again, the specialists have to sort out this particular problem during this particular stage. So the healthcare professional should be able to provide appropriate guidance and support to mother in these situations and ensure optimal breastfeeding success. Few more facts. We all know the incidence of cesarean section is rising in this particular country. 75% cesarean sections are done in urban area, while in 25% in rural area. But in a private and a government sector, the incidence of cesarean section is almost the same. It is said it is less there, probably it is just the same. And it is said that, you know, people who have cesarean section, the infants born by cesarean sections are 4 times or less likely to receive breastfeeding in this first 1 hour. And there the gynecologist role chips in. If Cloud9 Hospital can do it, I'm sure each and everybody can do it. It's the responsibility of the nurse, which comes from the nursery, plus of the pediatrician. And it is said that LSCS babies, the babies who are born vaginally, when they pass through the vagina, they come in contact with the good commensals. While in case if it is cesarean section, they are associated with hospital environment and hospitalized preterm babies, which do not have advantage of vaginal delivery. So in the neonatal period, the differential microbial colonization clearly is related to the mode of delivery. And it is said that by day 6, whatever the weight loss of the baby occurs, it recovers by day 6. In 20% of cesarean section group, this weight loss is recovered, while in comparison to vaginal delivery, the weight loss recovery is almost 40% in vaginal delivery groups. The people who are fed on a formula-fed infants are subjected to excessive loads of water and substrate, and this is not to be given. I will like Anita to dilate on this. So what choice you have? You have choice of breastfeeding, and you have a choice of, in case if this breast milk is not available, we have now donor human milk available. In many of the places, these are breast feeding banks are there, while now there is one company who has been there, which is they had been working in US and Australia. They have brought this particular thing here, and I think each one of you should see to it that sometime 2 or 3 feed in case supplementation is required. It should be human breast milk and not otherwise. So the choice of feeds is bovine milk formula feeds, big no. You have to give human milk. Either it is express if the baby is in the nursery, it is express breast milk, or a donor human milk if the mother cannot give it. So gut microbial profile, you all know the feeding type significantly influenced by the gut microbiome. The formula of microbial profile is distinct, that those observed by mother feeding and when it comes from the donor human milk. You can see the lady who has been on breastfed, there is a great bonding between the mother and child. It improves the gut flora for a stronger immunity, and these babies have higher neurocognitive scores. Benefits to parents: reduce hospitalization expenses. It lowers the risk of rehospitalization and lower risk of developing metabolic diseases in this particular child in future times. So the benefits to the hospitals are, it improves the outcome, neonatal outcome, in terms of mortality and morbidity, and it baby-friendly hospital compliance becomes very, very easy. Now I talked about these tropic feeds, and these are gut stimulating feeds. These are one and the same thing, they are only different names. What is the objective of these tropic feeds is maturation of the gut, gut priming. And the message which you take back from here today is it's the breastfeeding, breastfeeding, and breastfeeding. Because by breastfeeding, it is gut protective. Human milk is best and the largest source of good bacteria, and the human milk is protective against these infections, which are just listed down below. So the importance of tropic breastfeeding with human milk is, human milk stimulates maturation of the gut. It provides a rich source of pre and probiotics, strong anti-infectious effect from immunoglobulins passed on from mother to the child, protects against sepsis, neonatal enterocolitis, and death, and promotes postnatal growth and organ development. So we all know that a formula feed not to be given because it increases the chance of emesis in the child, distended abdomen, neonatal necrotizing enterocolitis, and longer days of IV nutrition, infection and sepsis in the child. So the human milk is always the safest and the strongest source of nutrition to the newborn. You can see the difference between a human milk, cow's milk and a formula milk. One thing is very clear, it does not have anti-infective agents as the human milk has. As far as growth factors are concerned, again they are very peculiar to breastfeeding. As far as minerals and vitamins are concerned, you can find that it is adequate in the mother's milk, while it is the cow's milk and other milks are definitely low in vitamin A and vitamin C. Same as for the carbohydrates is concerned. As an energy thing, it is lactose is plenty, and you find oligosaccharides are anti-infective, are much more there in the human milk, which is not there. The same is true with the effective fatty acids as far as the human milk is concerned, and the protein also very easy to digest, which is there in the human milk. This particular presentation will be there on the slide share, and I think everything will be available for you. Today's presentation of the 6th and the presentation of 7th, Malti will definitely see to it that she will load up. So what you take back from here? The golden hour nutrition ke kya fayde? Babies who are human fed within the golden hour have lower rates of ear infection, asthma, diabetes, childhood leukemia, and the sudden infant death syndrome. The babies who are fed on the formula feed have a higher rates of infections, gastrointestinal diarrhea in the neonatal period and subsequently, necrotizing enterocolitis, repeated hospital admissions, increased hospital cost, and later they have obesity and diabetes. So the recommendation for the tropic feeds is breastfeeding or the donor human milk, because the donor human milk is called donor human milk, DHM, while the milk which comes from the mother's own milk is called MOM. So finally, wrap up. The points to be emphasized for the gynecologists and other health professionals are breastfeeding in the golden hour. Education and counseling session to the patient should be done for golden hour, first day feeding, 6 months exclusive feeding, and for 2 years along with the solids after 6 months. Now, in these antenatal classes, first empower yourself. What is the right technique? Because in the 4 walls of medical college, we never had any training in breastfeeding. Nurses also never had any training in breastfeeding. So we are absolutely ignorant. Quite many things मिले. मेरे जैसे लोगों ने लैक्टोजेनेसिस मुझे टॉपिक मिला कि डॉक्टर साहब आप यहाँ पर चीफ गेस्ट के आएंगे और आप इसको ओवरव्यू दे दीजिएगा लैक्टोजेनेसिस का. I said, let me just put it. What is lactogenesis? I did not know, because I have not had any training of that particular kind. So I find, we have to empower ourselves with the knowledge and the skills, and then only we can definitely teach these people proper breastfeeding techniques, positioning and latch, and a milk supply management. People ask, डॉक्टर साहब पहले दिन मिल्क नहीं आया, दूसरे दिन नहीं आया, तो हम कहते हैं कि आप वेट करो, चौथे दिन से आपको फुल मिल्क आ जाएगा, and by 10th day it's flooding. It is said that by 10th day, the control from the hormonal control comes down to autocrine control. Natural हो जाएगा, वो जितना उसकी डिमांड होगी उतना उसको निकलेगा. So healthcare professionals have to really address the medical problems which happens in the baby as well as in the mother, and I think here the specialists need to chip in how to take care of this breastfeeding need of this newborn baby. So thank you very much. I think the message is very clear that first hour feeding has to be done by you gynecologists. It is 40% today across the country, and the data of the National Family Health Survey data 4 and 5, it is said that it is around 40%. As far as the breastfeeding exclusive breastfeeding has increased in the last 2 surveys, it has come to 65%. So thank you very much for listening to me.